Hello and welcome to AHA Team Training's video on TeamSTEPPS for the COVID-19 crisis. This video will feature TeamSTEPPS tools focusing on briefs, huddles, and debriefs. But before we begin, I want to introduce myself. My name is David Feldman, and I'm the Chief Medical Officer at the Doctors Company Group. In this video, we'll briefly educate you on the TeamSTEPPS tool itself, followed by how it can be applied during this critical time in healthcare. But first, we need to have a shared mental model on what TeamSTEPPS is. TeamSTEPPS, that is, team strategies and tools to enhance performance and patient safety, is an evidence-based set of tools designed to help healthcare professionals improve patient safety and quality through effective communication and teamwork skills. AHA Team Training is the leader in providing TeamSTEPPS education and support to the field. More than ever, TeamSTEPPS is helpful to introduce, spread, or sustain within your team during the COVID-19 epidemic. The tools we are featuring fall under leading teams in the TeamSTEPPS curriculum. Leadership is the linchpin that holds a teamwork system together. Any team member may take on the leadership role depending on the situation and the current team membership. When leading teams, a climate must be created that allows teamwork to flourish in support of patient safety and the delivery of high-quality care. Leading teams involves establishing a plan of care, identifying roles and responsibilities of team members, developing norms within the team for operating, and communicating the plan to all team members. Designated and situation leaders must monitor the plan of care and the surrounding situation to better anticipate patients' needs, effectively managing the resources to meet those needs, and adjusting the plan when necessary. Finally, leaders are looked to model appropriate behavior and reinforce and reward appropriate behavior when it is exhibited by team members. Team leaders are well-informed team members who make decisions and take actions. Team leaders establish the goals of the team and help maintain its focus. There are two types of leaders. The first type is the designated team leader. For a team to function successfully, a leader must be designated. This leader must have the knowledge, skills, and attitudes to achieve the established goals. In many clinical situations, the physician in charge is a designated team leader, but this is not a requirement. The second type is the situational leader. The responsibility of leading the team may change depending on the flow of the clinical scenario. Situational leaders emerge at designated times, such as during anesthesia induction, and at spontaneous times, such as the first responder to a code. In high-performing teams, any member of the team with the skills to best manage the situation can assume the role of situational leader. Once the situation has been resolved, or the designated leader is ready to assume control, the situational leader again assumes the role of team member. In our current environment, now more than ever, healthcare needs everyone to be able to step up and become a leader, whether designated or situational. The three critical tools needed for effective leadership are briefs, huddles, and debriefs. Briefs are planned events that occur prior to a teamwork event or set of events that allow the team to discuss a plan. This might include being sure they have the necessary resources and personnel. Examples include a team of obstetrics providers briefing at the board or list of patients in labor at the start of a day, or it could be the timeout prior to an operational procedure. Huddles are usually impromptu gatherings that might be necessary due to a change in patient's condition or the healthcare environment. This might occur in the ED when a patient with stable chest pain suddenly experiences a significant change in vital signs. Or it could occur during an operation when the surgeon feels conditions have changed that require going from a laparoscopic procedure to an open one. Debriefs occur at the end of a healthcare encounter where the team has an opportunity to review how they performed, next steps for the patient and or team, and how they could perform better the next time. For many teams, the debrief is an opportunity for learning, and so many have said it is one of the most important tools in all of TeamSTEPPS. In a brief, the team will typically review these elements. Who is on the core team? All members understand and agree upon goals? Are roles and responsibilities understood? What is the plan of care? What about staff availability, workload, and available resources? Other key points to remember about briefs: they are at the start or beginning of a team event. Also note that some have called these events huddles, but we shouldn't get too caught up in semantics. Briefs have been shown to be effective in a number of different clinical settings. This includes equipment-related complaints, instrument-related issues, supplies, personnel, case scheduling, preference card issues. There is also data showing that timeouts when performed in the context of a teamwork program can reduce operative morbidity and mortality. In one hospital, obstetric outcomes also improved significantly after implementation of TeamSTEPPS skills, especially briefs and debriefs. A huddle is an event that is not planned for, and so it is typically spontaneous. A team member will call for a huddle when problem solving is needed during a teamwork event. This can include regaining situational awareness, discussing emerging events, anticipating outcomes that might not have been discussed during the brief, assigning resources that are suddenly needed, and just to express concerns. And remember, anyone can call for a huddle. Think about situational leadership. In the debrief, the team has an opportunity to review their performance. Questions to be asked during a debrief might include, are communication clear? Roles and responsibilities, have they been understood? Was situational awareness maintained during our event? What about workload distribution? Did we ask for or offer assistance to each other? Were errors made or avoided? And then finally, what went well? What should improve? And what's one thing we might be able to do different next time? The focus of a debrief is typically process improvement, so that the team can better understand how to improve during the next event. However, a debrief can also be an opportunity for the team to check in on each other's feelings, especially when an event has been high tension, difficult, and resulted in an unexpected outcome. Ideally, a debrief is done after every event, not just adverse events, and may not be focused exclusively on the clinical, but rather team performance. Also remember that a debrief is not a D-long. We like to keep it simple and just focus on these questions. What went well? What could be improved? And what's one thing you'll do different next time? Especially after a difficult clinical episode, when things go well, the team is also allowed to be self-congratulatory. Here's an example of leadership tools that can be used during an especially difficult time like the current COVID-19 crisis. The ED is notified of 3 ambulances due to arrive with COVID-19 patients. Just prior to this, the ED lead physician calls for a brief prior to arrival. That way the team can really understand what to expect and how they're going to deal with this when the ambulances come. While caring for these patients, they receive notification of another 3 ambulances. Now the triage nurse receiving the call organizes a huddle as a situational leader. This way the team can gather and understand how they're going to deal with this sudden onset of more patients. After a few hours, when all 6 patients have been transported out of the ED, everyone is exhausted. And here a staff nurse calls for a quick debrief. The team assembles for just 2 minutes to share, and each team member sums up in 2 to 3 words how they are feeling. Some critical points to remember. Anyone can call for a brief debrief or huddle. And a script isn't always necessary, but in a crisis, having a checklist is helpful, and we'll talk about that shortly. Finally, leadership events don't have to be lengthy. Debriefing with just a few words from each team member is often enough. Finally, here's a tool that you might find helpful to augment your leadership events, especially during the current COVID-19 crisis. Most providers are familiar with the use of checklists. You might spend a few minutes with your team creating a checklist that can be used during your team's briefs or debriefs. Consider developing a crisis checklist to be used during a huddle. In times of crises especially, don't rely on memory to be sure everything is covered. Let the checklist help your leadership events go smoothly without missing anything. Remember, the checklist is a dynamic document and could and should be modified as needed. So, finally, AHA Team Training is here to support you during the COVID-19 crisis and for all your future patient safety and quality improvement needs. Feel free to get in touch with the team should you need any additional assistances or resources.